Hi, welcome. It's Dr. Kohlberg at Anxiety Experts. Does your anxiety ever get stuck on your health? Maybe you're wondering if you have rabies, AIDS, or cancer. Stay tuned. We're going to talk about that today in our Anxiety Experts tip. Don't forget to like this video and subscribe to our channel so you can get Anxiety Experts tips every week. The thing about anxiety is it loves to get stuck on anything it knows will scare us. And most people have had a health scare from time to time. So anxiety will use that to tell us to take extra precautions that people without anxiety or OCD aren't taking. It wants us to go to extra doctor's appointments, read articles compulsively on the internet to try and get what no one can have, which is to be sure we don't have a terrible disease. If your anxiety is stuck on health, the most important thing to remember is that anxiety lives on the 3 safety behaviors of avoidance, reassurance seeking, and rituals. These 3 behaviors create the false sense of safety or certainty that the anxiety always seeks. That's the thing that OCD or anxiety will always convince you to do. So once OCD or anxiety gets stuck on your health, it will ask you to avoid touching things, going places, being with people, eating certain things in order to get certainty that you won't become sick. However, when we're doing these avoidance behaviors, we're increasing both our thoughts about health as well as baseline anxiety during the day. Same thing with the second safety behavior of reassurance seeking. When we are asking our loved ones, do you think that this ache in my side could be a sign of stomach cancer? And they are providing reassurance for us. This is a compulsion because even though you may get temporary relief after the person answers you, the job of OCD is to just bring more doubt. So there will never be enough doctor visits, articles, questions that you ask your loved ones at midnight to try and be certain that you don't have a terrible disease. The third safety behavior, the rituals or compulsions, is very important to identify because it can also be sneaky. Compulsions related to health anxiety are things like checking your body internally, scanning it for signs or symptoms of illnesses. Well, I read that bats can sometimes carry rabies. And what if when I was out with my friends the other night in the dark and we saw something fly by us? What if it was a bat? And I should be having a rabies test now because rabies is always fatal and I shouldn't take the chance that maybe I could be dying from rabies right now without knowing it. So the gauge that I want to give you to know if something is a real health concern or if it's probably your anxiety or OCD, ask yourself the question whether or not 3 reasonable people you know with lower levels of anxiety would investigate this as a potential health problem. So if 3 people you know with lower levels of anxiety are not getting a rabies test after you all saw something fly by you the other night, then you aren't either. You're going to make your best guess that you are safe and you're going to go on normally until you have a symptom that, again, reasonable people would go to the doctor for. The problem with going ahead and doing a safety behavior is that even though it makes you feel better in the short term, it worsens 2 types of symptoms in the long term. Those being your thoughts about health issues and your baseline anxiety during the day. So even though you're doing the safety behavior to make yourself feel better, you're actually making yourself feel worse every time you do it. On the other hand, each time you resist a safety behavior of avoiding something, seeking reassurance, or doing a ritual, such as checking your body, checking the internet, or illnesses you could have, going to the emergency room, going to extra doctor's visits, or having tests that were not ordered by your doctor, trying to convince your doctor to get you tests that you think you should have, playing doctor, in other words, anytime that you resist one of those behaviors, you are shrinking the frequency and intensity of your thoughts about health, your concerns about health, and you're lowering your baseline anxiety. Each time you resist a safety behavior with regard to your health, it will get easier to do that in the future. Of course, the first few times you resist safety behaviors, it's going to be very anxiety producing. I always say the first time is the worst time. When you have a thought that maybe you should look something up about pancreatic cancer and you resist going to the internet websites about that, you're going to have a spike of anxiety that feels very uncomfortable. The number 1 body sensation of which is nausea, heart racing, sweating, shallow breathing, numbness and tingling, or derealization and depersonalization, any of which can feel like a health problem or a mental health problem. So, when we have our normal body sensations of anxiety, we want to assume that they're just that, anxiety, instead of trying to make meaning out of them as a potential health problem. It's important to remember that looking up articles over and over again on health on the internet is a compulsion, and whether you look up one article or 1,000 articles, you will be no closer to what anxiety and OCD want, which is 100% certainty that you are safe. As I said before, the job of OCD or anxiety is to bring more doubt after you do the next compulsion, seek the next bit of reassurance from someone you care about, or do the next avoidance behavior. So it's all for nothing, because no one can have guarantees about their health, however much we might like that. So no one ever gets what anxiety or OCD want, which is to predict the future of their health. We all are accepting the same risks about our health, and we go on normally having our yearly physicals, and not any more physicals or evaluations or tests than our physician orders. Even though all of science, all of medicine is guesses and estimates, we're going to trust the best guess of the physicians we see. We're going to wait for real, present sensory evidence of an actual health problem that someone else would go to the doctor for, and then we'll go check it out. The number one treatment for health anxiety is actually exposure with response prevention. This is a treatment where we learn to accept the uncertainties about our health that people without OCD accept more readily. So we go through a series of exposures, both thought exposures and situational exposures, to learn to become the master of our health anxiety or OCD. I hope you'll join us at Anxiety Experts for either our outpatient or intensive outpatient program. Exposure with response prevention is the number one treatment for the entire anxiety spectrum, including health anxiety. Learn to master your health anxiety on video through telehealth sessions. It takes 16 to 20 exposure with response prevention telehealth sessions to become the master of your OCD or anxiety.